Hi, my dear friends. Today we will discuss the complications of Kerarings which implanted by femtosecond laser technology. Introduction. Keratoconus is a progressive non-inflammatory disease affecting the cornea, which is bilateral but asymmetric. Treatment modalities of keratoconus include hard contact lenses, corneal collagen cross-linking, intracorneal ring segments implantation, and keratoplasty. The goals of rings for keratoconus management to improve the uncorrected and best corrected visual acuity and to decrease high order aberrations by decreasing the corneal curvature and to increase the contact lens tolerance by corneal flattening. So we prevent the need for corneal transplantation. What can be expected from rings? Usually, rings causes reduction in the spherical equivalent by a mean of 1.45 to 3.46 diopter and decrease in the cylinder by mean of 0.24 to 2.88 diopters. Also, key readings decreased by mean of 1.57 to 5.59 diopters. Types of rings which used to treat keratoconus: intacs, Kira rings, and one complete ring which is called Mayo ring. Methods of implantation of rings, whether by femtosecond laser tunnel creation or by manual tunnel creation. Advantages of femtosecond tunnel creation: it produces precise depths, precise incision site creation, easier than manual, which is still a difficult technique, and avoid complications of manual tunnel creation like corneal perforation, epithelial defect, asymmetric ring segment placement, stromal edema around incision, and extension of the incision toward the visual axis. This video describes the technique for ICRS implantation by femtosecond laser. We can notice that we now apply the suction ring to the cornea, and here we can see the docking, which is flattening of the corneal surface before application of the femtosecond laser. Then femtosecond laser perform the tunnel creation around the visual axis of the patient. Here the tunnel is created. Then we will open the incision site to ensure easy entry for Kira ring segments. We try to dilate the entry for both sides to ensure easy ring segment implantation. Here we can notice that we use the first ring implantation in the wound and its entry is easy. Then we introduce it deeply through the tunnel. We push the ring to keep it away from the incision site, and then we implant the other ring segment. Here we implant the other ring segment and introduce it through the wound. Finally, we apply the soft contact bandage lens. After this period of intracorneal ring segments implantation, and we have some experience in film tunnel creation, however, complications can occur even with femtosecond laser implantation. Complications that has been reported include intraoperative complication, including incomplete tunnel creation and decentered created tunnel, and postoperative complication, including migration, extrusion, infection, crystalline deposits formation, and sterile keratitis. Incomplete tunnel creation mainly occur due to incomplete distribution of femtosecond laser bubbles, so the tunnel created at one side only. It mainly caused by inadequate docking or slight movement of the patient head. The problem of these complications is that only one ring segment is used with less effect. In this pentacam, we can notice in the tangential anterior map that there is one tunnel only applied while the ring in the other side is not implanted, with less flattening effect as we need. Avoid trial of ring implantation by force to avoid endothelial perforation as the tunnel is not formed. Second complication is decentered created tunnel. Here the tunnel is created, but it is away from the visual axis. We create the tunnel around the visual axis. If the tunnel is shifted slightly downward, the centration is away from the pupil. This decentration may be severe to the extent that making rings cross the pupil, as in this photo. This shamflock imaging shows that the ring in the front of the pupil due to tunnel decentration. Take care in this case any suspicion in accuracy of the centration of femtosecond laser tunnel creation, you should abort the technique. Another complication is migration and extrusion. Extrusion and migration both are two steps related to each other, as migration occurs before extrusion. Causes: if we implant thick segment in a thin corneal thickness, or in case implantation of segments near the incision sites, or caused by corneal melting. As in both photos, we can notice that there is extrusion of one end of the ring from certain side. Here, removal of the ring is inevitable. This photo shows late case of extrusion ended by corneal scar formation. Don't try to deposit the ring inside the tunnel, which may lead to infection, endothelial perforation, multiple migration, and extrusion will occur again. Another less common complication is sterile keratitis, which is immune reaction occur in the tunnel around the ring in the form of white infiltrates. Only one case recorded in published paper. 2 cases reported in our center and linked mainly to vernal keratoconjunctivitis cases and respond well to topical steroids. You should fear that this case is a suspect infection cases, so strict follow-up is needed, and if no response to steroid therapy occur, please explant these ring segments. My personal lesson from this case: keep away from vernal keratoconjunctivitis cases in intracorneal ring segment implantation. Crystalline deposits around the rings. Crystalline deposits in the channel of the ring were reported in 2 cases. The deposits aggregate in space around the ring with no inflammatory manifestation and with no effect on the visual acuity, with no accompanying haze. Infection, one of the grave complications, usually starts as low-grade infection. Explantation of the rings with intensive topical antibiotic are the only treatment. As in this case, we can see the site of infection and we remove the rings. Home message from this presentation: we should know that Kerarings implantation with femtotunnel creation has a very low rate of complication. However, intraoperative complication can be avoided by experience, as they are mostly related to the patient and to the device. In postoperative complication, any suspicion needs to explantation of the ring. Reference for this presentation: my 2 articles published about this topic, which is complication of rings in form of extrusion of femtosecond laser implanted corneal rings, and the second is intracorneal ring segment complication from novelty to expertise. Thank you very much, and I hope you enjoy my presentation.